Sayang. Okay, ayan. Ay, naluya pod ko, class. Okay, sige lang, sige lang, sige lang. No, we're all in this together. We can do this. No, you got this. Mga madapaka. Madapaka ha, madapa. Yan, mapandol, mapandol. Na, mga madapakas. Ayan. Gago, isumbong ko ninyo kay Sister Aida. Unsa man daw last name ni Sister Aida? Naigiingon sa kuha nga si OP ang gitubag. Sister Aida OP. Okay. Tubuan. Sige na. Ito, I've already given you the anong tawag ito? Yung inyong handouts nito. So you just have to listen. Badali lang ang ating discussion ngayon. No? It will be just short. Ay, Diyos ko Lord. Nakonsensya ko sa inyo ang mga scores class na kuan. I'm really sorry no, for your scores. Pero I want you to earn talaga your scores talaga. No? Sige lang, I will be adjusting that one. Ito. Okay. Grabe hilak, pailakon jud ko. Okay, sige. Ako'y angay, muhilak. Okay, fluid volume excess. Let's talk about your fluid volume excess. It results when body water and sodium are retained in the body. Remember that if you're going to combine water retention and sodium retention, of course, excess talaga yan siya. Okay, that is the complete opposite of your deficit or of your fluid volume deficit. It may be caused by your fluid overload, excess water and sodium intake sa atong dietary, no? Let's say for example, nag-apil ka og kuan, eating contest, no? And then para madaog ka, sige lang kag inom og tubig, and then suddenly you collapse, no? You will lose consciousness because you got acute hyponatremia. Okay, and because of that sodium or that excessive water intake. Okay, or by impairment of the mechanisms of your homeostasis. Sir, ano ba itong mga homeostasis natin? Ito yung kaka-quiz lang natin, di ba? You have there your aldosterone. Sir, fluid volume excess tayo ha, aldosterone. Okay, aldosterone. What do you think will happen to the aldosterone? Dapat hypersecretion ba? Will your hypersecretion lead to your fluid volume excess? Yes or no?
No, sir.
Taas ang aldosterone level. Kung taas ang aldosterone level, will it lead to fluid volume excess?
Yes, sir.
Yes, exactly, because it will promote sodium retention. Okay? So increased aldosterone, that's one of the anong tawag dito? Impairment of your regulatory mechanisms, yung mga hormones natin. Okay? Ano pa? You have there your increase yung ating cortisol. Increase cortisol levels that would promote fluid volume excess. Okay? Tapos meron pa. Increase ang ating, I'm sorry, not increase, but hyposecretion. Hyposecretion of your antidiuretic hormone. That is basically your DI. Okay? Decrease ADH natin or your diabetes insipidus. Okay? I'm sorry. Sorry. Increase day dapat. Sorry, tama. Sayad da ito. Sayad. Okay, that is your sayad. Okay, so ayan. And you also have their excess fluid can lead to your hypervolemia. Remember, this is your intravascular. Class, bakit nagkakaroon ng hypervolemia? That means that pag sinabi natin hypervolemia, increase ang ating blood volume. The result or the effects of your increased blood volume, increase ang BP. That is hypertension. All of which is pointing to your fluid volume excess. Okay? So makita kayo bukas ng mga questions na hypertension. Fluid volume excess yan. Of course, hindi man talaga yan fluid volume deficit because you are expecting that the patient will have hypotension. Kuha natin. Ayan. Hypervolemia kasi nagkakaroon ng congestion. Congestion, is it fluid volume excess? Yes, of course, it is always fluid volume excess. That means, di ba, sabi ko, always ko na to gina-reiterate sa inyo that when we're talking about congestion, there is a buildup of fluids doon sa ating intravascular space, or intravascular space or in our intravascular or sa loob ng ating blood vessel. Excess interstitial naman, pag sinasabi natin interstitial sa labas ng ating blood vessels, that is already your edema. Kuha natin, di ba? Na-lecture ko before that if there will be fluid shifting from the intravascular going to your interstitial, swelling tayo dyan, edema tayo dyan. If there is a fluid shifting from the interstitial going back to your intravascular, tataas, or there will be a point wherein magkakaroon ng congestion. Okay? Kasi tapok man ng fluids niyo dito sa inyong blood vessel. Okay, ayan. So your etiology, ano ba yung cause natin? Okay? So it results from condition that cause retention of both your sodium and your water. Remember, this is the major regulatory electrolyte for your water. Okay? Kung saan mas mataas yung sodium, doon pupunta yung water natin. Okay? So this is your, ano ba to? PSO, sodium outside. So this is your cation, no? Most abundant cation in the extracellular compartment. Okay? So kung mag-build up yung sodium natin sa loob ng cell natin, it will now attract fluids from the extracellular papunta doon sa inyong intracellular. Okay? Kaya maburot na siya. Okay? Now you have there your heart failure. Of course, bakit nagkakaroon ng fluid volume excess sa heart failure natin? Because right now there is congestion. Okay, ito talaga yung leading cause or the effect of your heart failure is congestion. Sir, bakit nagkakaroon ng congestion? Remember, for your heart failure, bakit napapagod yung puso natin? It's because of your secondary effects of your comorbidity such as your hypertension. Okay? Para anong tawag nito? To combat your hypertension or the increased arterial pressure of your blood vessels, it needs to overcome that pressure. So kailangan niyang mas mag-double work or mas mag-double effort for it to pump blood. Kuha natin. Kaya napapagod. Pag chronic na kasi, usually for the heart failure, it is chronic most of the time. Depende na lang sa acute setting or acute setup natin. Okay? But for your chronic heart failure, nagkakaroon talaga ng congestion tayo dyan. Okay? Now, here's the thing. If we're talking about the congestion sa ating heart failure, diba, remember you have there two types of your heart failure, your left-sided heart failure and your right-sided heart failure. Okay, question ko sa inyo, saan dito sa dalawa na ito, left or right, pili lang kayo left or right, would develop first? Left or right?
Left, sir.
Left, sir.
Yes, exactly. It is your left. Bakit? Because remember that the one responsible, you have there 4 chambers. Ang pinakamataas na workload, okay, for your 4 chambers is yung inyong left ventricle. Okay, kasi yung left ventricle mo is responsible for pumping blood, okay, from of course, from its chamber papunta sa aorta and going to the different circulation or different parts of your body. So it is the one that is responsible to overcome the pressure that is being given by your systemic circulation. So your left side ang pinakauna dyan, and then after that one, magko-compensate talaga yung ating right side na heart. Okay, kasi ito weak na ito eh. Okay? So pag dito, kaya nga mapapansin ninyo, you have there I know you're familiar with this one, left ventricular hypertrophy. Remember, hypertrophy. Remember that your heart is made up of your cardiac muscles as well. Okay? That is why, kung babalikan natin yung anatomy and physiology natin, it is on your left ventricle that has yung may pinakamakapal na walls ng ating heart. Okay? Because it is the one that is responsible for really ejecting your blood towards the systemic circulation. Kuha natin. So you will have their left ventricular hypertrophy. What does this mean? Left, sa left side. Ventricular means it is talking about your left ventricle. Hypertrophy, ni dako, ni baga, nag-hypertrophy. Okay? The opposite of that one is your atrophy. Okay? So kaya yun siya ganun because of course your left ventricle is the one pumping talaga the blood towards the systemic circulation. Now ngayon, okay, after your left-sided heart failure, pag hindi ito siya matreat or if there are no medical management for that one, eto, unti-unti itong mapapagod din yung ating right-side heart failure. Now, before we go to your right-side heart failure, remember that if ever man napapagod yung puso natin, hindi na yan siya magko-contract. Or not really, hindi na siya magko-contract. It will not contract effectively. It will not contract, anong tawag ito? Completely. And the fact that your left ventricle ni baga ang imong heart sa left ventricle nimo, okay, what do you think will happen? the space will be kuan na liliit yung space mo because of course nibaga tong wall sa imuhang left ventricle, so ang blood or there will be less blood that will be pumped no doon sa ating systemic circulation. Kuha natin. And aside from that one, since we're talking about left-sided heart failure, pagod na siya mag-contract. There's a possibility, not really a possibility, there is a backflow of your blood from your left ventricle papunta sa ating lungs. Diba? If we're going to trace the backflow of that one, hindi na masyado siya mag-contract. So, from the left ventricle, aakyat yan siya sa inyong left atrium. From the left atrium, pupunta ngayon yan siya sa inyong pulmonary veins, because remember the pulmonary veins are the ones that carrying your oxygenated blood, and then from the pulmonary veins magsistasis yan sila doon, mag-build up yun sila ng pressure. We're talking about the blood vessel here, ha? So magko-congest yan sila doon. That's the reason why there will be leaking of your capillaries doon sa lungs natin. And if we're talking about your left-sided heart failure, what are the signs and symptoms of your left-sided heart failure? I-base natin yun doon sa explanation. If there will be backflow of your blood from your left ventricle going to the lungs, okay, tapos magli-leak yung inyong anong tawag ito? Magli-leak yung inyong fluids, you will have their crackles. Okay? Pulmonary congestion. Okay? So you have there your crackles. Ano pa? Cyanosis. Ano pa? Dyspnea. Ano mapapansin niyo? It is all related to your respiratory. Kuha natin. Pag left-sided heart failure, most of the time, or not really most of the time, almost all of the time, no, ang ating mga manifestation dyan for the patient is of course yung mga pulmonary congestion. It has something to do with the respiration. Okay? Crackles upon auscultation, maririnig mo yung mga adventitious sounds, and you also have there your cyanosis, the bluish discoloration, and of course your dyspnea. Dyspnea. Okay, ayan. Now for your right-sided heart failure naman, paano natin malalaman ang mga manifestations dito? For your right-sided, remember, right. So there will be a backflow from your right ventricle papunta sa inyong right atrium, okay? And then papunta sa inyong either your superior vena cava or your inferior vena cava. Okay? And then saan ba yan sila pupunta ngayon? Sa inyong peripheries or sa inyong peripherals. I'm sorry, sa inyong peripherals. That is why there is peripheral congestion. Okay. Congestion. Okay, bakit for your peripheral congestion, what do you think is the manifestation of this one? Edema. Peripheral edema. Edema of your what? Pwede yan siya kung ang backflow niya is doon sa taas sa ating superior vena cava. O mag-edema ka sa imuhang hands. You have the edema of the hands, you have there the edema of the feet. Okay, ano pa? Yung ating ascites. Okay? That is part of your anong tawag dito? There will be an escape of your fluids as well papunta sa inyong peritoneal cavity, no? And that is for your liver cirrhosis, ascites natin dito. Okay, ascites. Ayan, that is the manifestation of your fluid volume excess. Sir, bakit nagkakaroon ng ascites sa ating liver cirrhosis? Remember, di ba sabi ko sa inyo that when we're talking about the cirrhosis of the liver or the liver cirrhosis, this is now what we call the failure, the failure of your liver to thrive, no? Nagiging it is failing already as an organ. Okay, so what happens there is that if ever there's cirrhosis of the liver or liver cirrhosis, mahihirapan ngayon yung flow ng ating blood papunta sa ating hepatic or papunta sa ating liver. So your hepatic blood vessels will have a slower blood flow. So ano mayayari diyan? Kung may slow blood flow or slow flow, di ba? Slow flow of your blood, there is a possibility na magko-congest yan siya doon sa ating hepatic vessels. And that means that if we're going to trace the hepatic vessels, of course, naman na gihapon dito, naman na tracing padulong sa inyong lower extremities. That's the reason why, aside from the ascites, magkakaroon ka din ng lower extremity na edema. Kuha natin. Ayan. So for the renal failure as well, bakit nagkakaroon ng fluid volume excess? Again, for renal failure, hindi na siya, it does not function anymore. Or the function that your kidney should do, hindi na niya magawa. Okay, which is number one, yung inyong excretion of your urine. So kung wala kang excretion or decrease ang urinary output mo, what do you think will happen to your fluids? Of course, it will just circulate throughout your body. Okay, sige ka inom og kuan fluids pero wala kaayo kay ma-output or wala kaayo kay maihi. So it will just stay, or there will be a buildup of your fluids inside your body. Maunang kanabit tong mga tao nga kailangan for hemodialysis and they missed a session kasi schedule man yan sila. Ano yung mga una ninyong mapapansin? Manghupong na sila. Ang naong, manghupong, ang kamot, manghupong, and even the lower extremities will have edema as well. So you also have there your adrenal glands disorder, one of which is, di ba sa adrenal gland natin, you have there your, ano ba yun, cortisol and your aldosterone. There will now be hypersecretion of your aldosterone. Another example is your hypersecretion of your cortisol. Sinabi ko na yun kanina. Okay? Dito din yan, corticosteroid administration. This one here, remember that one of the other name of your corticosteroid is, ano ba? I'm sorry, not corticosteroid, your antidiuretic hormone. Your antidiuretic hormone is vasopressin, while your cortisol, or another name for your cortisol is your glucocorticoid. It is a corticosteroid na siya. Okay? So if ever we're talking about iatrogenic causes or drug-induced na mga fluid volume excess, this one is an example, corticosteroid administration, because pag hindi ma-regulate yung pagbigay ng corticosteroid, or if the patient will be under long-term therapy of your corticosteroid, Cushing talaga yan. Okay, ang labas niyan, Cushing. Okay, there will be fluid retention there as well. Okay, so for your stress condition causing the release of ADH and aldosterone. Ayan, so nasabi ko na ito and nasabi ko na ito din. Okay, so ito, kung meron tayong tumor sa ating pituitary gland, okay, magkakaroon tayo ng SIAD. Diba? Dito naman sa aldosterone natin, meron tayong tinatawag na hyperaldosteronism. Okay? In some books, your hyperaldosteronism is your Graves' disease. Okay? Hypoaldosteronism is your Addison's disease. Pero pwede yan sa dalawa, yung cortisol ninyo or yung inyong aldosterone pag hypo secretion. Okay? Pathophysiology, actually, this will just be talking about the compensatory mechanism of your body. Now, once you have fluid volume excess, ano bang ginagawa ng katawan natin para ma-save tayo for for further damage? No, meron talagang ginagawa yung katawan natin. So you have there the extracellular compartment is expanded, okay, increase in volume or volume increases the pressure in the vasculature kasi there is hypervolemia. Nagkakaroon tayo ng hypervolume kasi nagko-congest sila eh. Vasculature means yung ating blood vessels. Okay, vascular. Okay? And then the baroreceptor sense, no? Uy, may congestion, tumataas ang pressure, may nagkakaroon ng hypervolemia. So you have here your baroreceptors. They are the ones that basically monitors the pressure inside our body, kung anong nangyayari sa ating katawan. So once the baroreceptors sense the increase in pressure, it will now send impulses papunta sa brain nyo. And then the brain analyzes that one, yung mga impulses natin, o yung sabi ng brain, ay hala, tag-as or the blood vessel is congested. So ang mangyayari dyan is that there will now be an increased firing in their central nervous system, and then your SNS is inhibited. Okay? Diba remember, umiihi tayo because of your parasympathetic action. Okay? Ang tawag nito, the feeling of voiding is still magtae, mag-ihi, it is being controlled your parasympathetic. Okay? Is inhibited, and then of course, once your SNS is inhibited, your RAAS as well function declines. So di ba yung RAAS natin, it addresses hypovolemia, it addresses hypoxia, it addresses your low blood pressure. Okay, dito naman, since fluid volume excess, wala tayong problema. Mataas na yung ating blood pressure eh. So ngayon, to compensate for that one, eto na, so nag-decline yung ating RAAS functioning. Okay, para hindi masyado mag-secrete ng aldosterone, hindi masyado mag-secrete ng angiotensin 2, wherein it would lead to further fluid volume excess. So nagkakaroon ng vasodilation, lowering of blood pressure, reduced reabsorption of sodium, and increased urine output tayo dyan. Okay? Ayan. Question so far? Wala. Manifestations natin, these are the... Okay. So manifestations extracellular fluid leads to hypervolemia and circulatory overload. Oh, ito na yun siya. Kanabitawang that is why it is very important, like if ever you were given activities sa inyong RLE wherein you're going to regulate your IV, tarungan na ninyo regulate. It's because of the fact that ito yung mangyayari. Okay? And I experienced this one no because of negligence. Kay nalisang lagi, I was restraining a patient. I think I told you already this story wherein the patient was inserted with NGT and then I was administering mannitol as fast drip every 6 hours. Fast drip na siya, 200cc man siguro to or 180cc or 120cc. Okay, kutubra 120cc. After 120cc, stop mo na kaagad yan, on mo na kaagad yung plain NSS mo. So what happened there was that nahurot na ko ang tambal, ang mannitol mismo or the anong tawag ito, hypertonic yung solution na hypertonic solution. At the same time it was a diuretic. Yung nga sabi ko, nasabi ng patient ay ng watcher, sir, di ba kutubra man na dira, ano ko lang kapatay, isaka jud ako ang itlog class na adre, mapalpit jud ako kung itlog, ano ko yati ra akong itlog nasaka na sa akong liog. Okay, kay nakulbaan ko. So tiningnan ko kadang drug handbook, ana ko kagi circulatory overload. Ang manifestation, restlessness. Unya at that time, restless na daan ang patient. How would you know that the patient is already undergoing circulatory or experiencing circulatory overload kung na siya restlessness daan? So it will mask kung asa dito, asa diri. Unsa ba ni restlessness ba ni tungod kay it is increased ICP na kasi head injury man yun siya eh. VA siya, VA vehicular accident. Sus class na ako isa ka pasyente sa gawas wala na ako gitagan. I did not do anything. No, wala jud koy gibuhat dito sa PICAS or sa gawas nga patient that was in Euro ICU sa SPMC. And duha man na sila magod ang department nila, okay? Naa na sila ICU and paggawas nimo sa ICU, kuan kaagad ward dayon na siya, general ward kaagad yan siya. Pero neuro cases yan siya. So wala jud koy labot ato. Okay, gipangutanan na lang ko sa CI, siguro ang CI naluoy po sa kuha kay kahila ko na jud kay ko nagload na jud ko sa kuan sa patient ato. Sir, kaya mo yan, sir. And of course, after 7 days nakuan siya. Na-discharge siya, no? Ni kuyos jud siguro yung utok ato, no? Kaya naman siya cerebral edema. Okay? So nato, so be careful. No, be careful kay napod ko yung student just now that gipa-regulate na ako ang tingala ko at the end of the rotation or at the end of the time ba sa kuan sa RLE, ana siya, sir, pwede ka masturya kay babay naman, dismiss naman. Mo tingala ko nganong gusto niya muhawa tanan kay musturya lagi daw siya ato. Of course, ang giingon niya sa ako sani. Unya na. Wala ba daw ko natagan og extension or punishment? Ichika na ko na. Okay. Unya na. Kato sa student karon ana siya, sir, nahurot good ako ang IV. Ano ko, haki, unsa man na nimo pag-regulate? Remember, di ba, we have their macroset and microset. Di ba, pag microset, di ba, mamana itong needle sa imuhang kuan, sa imuhang spike or sa imuhang drip chamber. Okay? Kani siya nga needle, that is your microset. Ang isa is ani, okay? Tapos wala siya needle, that is your macroset. Macroset yung sa kanya. Okay? And then the rate is 100 cc per hour. That means that, of course, every hour dapat ang mabawas sa imuhang IV infusion is 100 cc, di ba? Tama. Now question sa inyo ha, if ever you are using a micro drip, pila ka drops per minute na siya? Tapos 100 cc per hour. Madali lang yan. You don't have to compute. Tingnan nyo na ang rate. Diba pag microset tayo, tapos ito yung rate na binigay sa iyo ng doktor, of course, that will be 100 drops per minute. Kuha natin. Now, if the drop factor, kung sa macroset tayo, tapos 15 ang drop factor niyan, you have to divide this one by 4. Kung 15 ang drop factor ng inyong macroset, because diba yung macroset natin meron siyang 10, 12, 15 and then we also have there 20. Sa San Pedro Hospital, ang ginagamit talaga nila dyan is yung 15 na drop factor. So you just have to anong tawag nito? You just have to divide this by 4, so that would be 25 drops per minute. Ngayon, ang ginawa niya, giregulate niya yung kuan, yung IV, 100 drops per minute. So what do you think will happen? Ang 100 cc per hour nahimong 400 cc per hour. Kasi ginawa niya itong microset. And remember, this is macroset. And if you're going to regulate 100 drops per minute with 100 cc per hour, mo exceed yun na siya. Okay? So i-remember nyo na lang, if in ato ang situation, tapos wala pang patient, ayun, magkakaroon talaga yan ng circulatory overload yung pasyente ninyo. Okay? So there will be dyspnea, coughing as well, restlessness. Sir, kung sinetabo sa imo atong katunga adlaw, of course, IR, incidental report, pwede ra gud kayo kung mag-jury ato class, no? Napod ko isa ka kuan, groupmate ato mang taspod, naka-overdose po di ito siya, pero ang iyang giingnan, dili ang CI, no? Ang staff nurse, unya ang staff nurse na ra, okay ra na. Okay? So sino ang tutularan ninyo? Si Sir Antone na na naging honest sa CI o yung isa na naging honest sa staff nurse?
Katong isa kay YIR.
Sir.
Hoy, katong isa. Kuya, puno ko iyang utok, no? Kay dito jud siya, wa jud siya sa staff nurse jud siya diretso. Okay.
Sir, safety first.
Basig musaka po ng ilang itlog sa liok. Okay. Dili bitaw class. So again, if ever you will be having troubles or may nagawa kayo, report nyo kagad sa CI yan. Okay? Siguro po na understand sa CI sa akong IR, butang man na nimo dito mga reasons nimo. Kuan yun ako, gi-restrain yun ako ang patient, pero it will still fall under negligence. Kay you are multitasking. Okay? Nagpahiro-hiro, mauna. Okay, mao po tong same CI gihapon, same ward gihapon, IR na pud ko kay gitudloan nako ang isa nako ka grupo nga mag-suctioning. Okay, kay of course ako nagpatudlo man pud ko na dito ang CI nag-observe a suction. Nya kana bitong feeling nga wow, naka-suction nako, kuyaw na kayo kung kuan ba pinamati ba kay hawda na ako suction. Okay, kay nakabalo naman ka. You were able to observe and you were able to do it. So after that one, na po'y katong kagrupo nako, siya gihapon ha, siya gihapon, same gihapon. Katong gi-report sa staff nurse ang pagka-overdose pero wala si CI. Gitawag ko niya nagpatabang, dogs. Dogi man nila tawag sa kuwaso na. Dogs, kuan patabang ko be. Ana. All the while I thought nagiina na niya ang CI. Okay, atabang po ko kay syempre, kuan lagi ambugiro kaayo. Bay kabalo na jud kuan suctioning. Sige tabangan ako, okay. Nidulang CI ni tan-aw ra pod. Wala po siya nagsaba-saba. After the procedure was done, na isa ka groupmate na ako, gipatawag kang ma'am, duol dayon ko. Siyempre ako, proud ko kay nakatabang ko ba. Ana bitaw, feeling ba na chin up pa, kung lami pa kayo confidence ka padulong sa CI. Ana siya, Mr. Antone. Yes ma'am. Smile pa ko. Ano bang gagawin ng student pag first time niya magawa ng procedure? Call the CI ma'am. With all the conviction jud ko, call the CI niya. Ngising-isip ako kay, syempre tama man kayo kung answer. Ano siya? Mr. Antone, CI ka ba? Kato. Ano kayo? Jud aning. Wala pa dahil na nanghid pod tong katong groupmate na to. Sige. Tungod ato na IR na pod ko. Best in IR. Okay, those are the kuan. Pero class no kato sa Manitol na ako'y 1 point ato sa board exam kay ni gawas pa jud to. So kabalo na jud ko for us ato nga kuan drug. Okay? Cerebral edema. Di ba? Hawd kayo ko naman Manitol. Excess fluid interstitial, going back. Interstitial space causes peripheral or generalized edema. Okay, ito yung sinasabi ko yung peripheral congestion, di ba? So your peripheral edema, kung severe siya, it's called your anasarca. Okay? This is what we call your severe generalized edema. Paano nga ulit mag-assess ng edema natin for the peripheries or for the lower extremities, di ba? Mag-start tayo dun sa feet and then try to palpate or try to press it and check kung hanggang saan yung edema niya. Because the higher ka magpalpate, that means that grabe na masyado yung ating fluid volume excess. Okay? The lower naman, it does not mean na it is not dangerous. It's just that hindi pa ganun ka kalaki yung excess fluid natin. Okay? Full bounding pulse, descended neck. Okay, guys, remember, full bounding pulse yan siya. Okay, nagkakaroon ng palpitations, bounding. Okay, it's because of the fact that increase ang ating arterial pressure niyan. Kasi nga, merong congestion. Kung distended neck dito, what do you think is the counterpart doon sa ating fluid volume deficit? Distended neck veins dito. Doon sa kabila, sa fluid volume deficit, it is your what? Flat neck veins.
Flat.
Very good. Okay, it is your flat neck veins. So you also have there, kung sa CVP natin, di ba yung introduce or nag-discuss ako ng CVP ninyo, kung sa fluid volume deficit, it is decreasing, okay, decrease siya. Dito naman, of course, increased siya. Okay? You also have there your cough because of your pulmonary edema or your pulmonary congestion. You also have a dyspnea, orthopnea. Okay, sir, ano ba to orthopnea? This is basically difficulty breathing when in supine. Okay, difficulty breathing in a particular position. So anong ginagawa natin dyan? Elevate the head of the bed. That is basically what you call your semi-Fowler's or your Fowler's position. Dyspnea at rest as well, no? Nagkakaroon ng difficulty of breathing at rest pa na, ha? Okay, nagkakaroon in a normal person, nagkakaroon lang tayo ng difficulty of breathing if ever we are undergoing extraneous activities. Okay, or strenuous activities. I'm sorry. Ito, tachycardia. Sir, tanong, meron bang tachycardia sa fluid volume deficit? Yes or no?
Yes, sir.
Very good. Yes. Ngano, sir, ganun pareho sila because number one, doon sa ating fluid volume deficit, because we have there a dehydration or deficit tayo sa blood volume natin, your heart is trying to compensate for that one. Kaya siya bumibilis ang pagtibok niya. Okay, para ma-push or mas mabilis ang pag-push ng inyong blood papunta sa inyong systemic circulation. Dito naman, the tachycardia here is caused by your increased congestion. Okay, so both your fluid volume deficit and fluid volume excess manifest tachycardia. Dito hypertension, doon naman sa ating fluid volume deficit, that is hypotension. Okay, but do not mistake yourself, class. Pag sinabi kong tachycardia sa ating fluid volume deficit, it is a compensatory mechanism. That means that after a while, okay, if ever there will be no management being treated to the patient or being given to the patient, bababa yan siya, magkakaroon siya ng bradycardia. Okay, reduce oxygen saturation as well. Okay, and you also have their moist crackles on auscultation on the lungs, pulmonary edema, yes, nasabi ko na ito, and increase urine output. Okay, sir, bakit nagkakaroon ng increased urine output? When we're talking about fluid volume excess, this is fluid retention. This is also a compensatory mechanism. Okay, di ba na-discuss ko sa inyo kanina yung doon sa pathophysiology? Okay, compensatory mecto siya. Okay, para ma-relieve ang congestion, para oh my God. Wait lang, class. Ayan. Para ma-relieve yung inyong hypervolemia. Okay, let's now go to ascites. Nasabi ko na ito siya. There will now be an excess fluid in the peritoneal cavity. No? Nag-escape yan siya. That is why, remember, okay, ano yung ating what is the dietary plan for your patient with liver problems? Let's say, for example, liver cirrhosis. Increase protein intake or decrease protein intake?
Decrease, sir.
Okay. You have there decrease.
Low protein.
Okay, decrease dapat ating low protein diet tayo dyan. Okay, low protein. Sir, low protein, when we are talking about low protein diet, it does not mean that we are restricting the patient from eating protein or foods rich in protein. Hindi po. We are just trying to decrease it. Hindi naman natin, or we're not saying that the patient should not eat protein. Meron pa naman, pero kokonti lang. Okay? Decrease protein diet. Sir, pag ganito kasi, pag liver problem, magkakaroon tayo ng hypoalbuminemia. That means that, anong nangyari sa hypoalbuminemia? That means that there is low albumin levels circulating sa ating blood. Okay? Kasi that is the effect of your liver cirrhosis. Low protein levels sa ating blood. That is why they give human albumin. And this one is given IV. Ito naman, diet natin oral yan. Okay? So pagbigay natin ng albumin, it will not be passing through your or anong tawag dito? It will not undergo the first pass effect, and it will not hindi na siya pupunta doon sa liver ninyo para ma-metabolize. Diretso na yan siya sa inyong blood vessels. Okay? Para to increase the colloid oncotic pressure, para ma-pull back niya, no, from the interstitial, kasi remember, this is your ascites, peritoneal cavity. So from the interstitial, ibabalik niya ngayon sa ating intravascular. Okay? Ayan. Sir, bakit decreased protein ang ating mga liver cirrhosis? Because they will be having a hard time, no? Kasi kung sige gyapon kagkaon og protein, you will be putting your liver or putting stress, no, you're going to increase the stress level um of your liver tungod kay, of course, kailangan man good, or the liver is the one responsible for metabolizing your protein. Okay, kuha natin. And pag mas magtaas pa talaga, or if you're going to give increase or high protein diet to the patient, no, yung ammonia, yung ammonium level natin. Okay, remember that your ammonia is the byproduct of your protein metabolism. And remember that your ano tawag dito? Your liver needs to metabolize ammonia to become urea. Okay, so you have there your protein. Okay, your protein, the byproduct of your protein is ammonia. Okay, and then this ammonia here needs to be metabolized by your liver, okay, to become your urea. Sir, bakit ba? Bakit mo may sinasabi? Because of the fact that, ito nga, bakit siya low protein diet dapat? Okay, so that means that if you have their low protein diet, that means magdi-decrease din yung ating ammonia. That means that hindi masyado mas-stress yung ating liver to metabolize your ammonia to become urea. Once ma-metabolize na siya into urea, it can now be excreted. Sino nag-excrete nito? Excreted. Anong organ? Kidney.
Kidney, sir.
Very good. It is your kidney. Okay? Mauna, pag naakay problems with your liver, either your liver or your kidney, low protein jud na siya. Okay? Low protein diet. Okay? Ayan. Decreased hematocrit and BUN, because remember class, when we're talking about hematocrit, ito yung concentration again with the solute particles and with the blood, no? You have there the ratio of your red blood cells and of course the whole blood, no, or yung blood niyo as a whole. Okay? Pag decrease yung ating hematocrit, that means that what? Nagkakaroon ng dilution sa ating anong tawag dito? Sa ating blood. Okay? Dilution of your solute particles. Kasi nga, there is fluid volume excess. Okay? You also have there your BUN. That means that if ever mataas ang, I'm sorry, decrease man din, no? Pag decrease ang BUN mo, that means that what? Your kidney is still functioning. Okay? Pero nagiging diluted din yung inyong BUN, your blood urea nitrogen. Okay? You also have there your altered mental status, such as your ano tawag dito, loss of consciousness, lethargy, yan. Okay, if I'm going to ask you, this is a general term class, altered mental status. Do you think that altered, or do you think your fluid volume deficit can also cause alteration in your mental status? Yes or no?
Yes, sir.
Yes, of course.
O sir.
Okay? So pag meron kayong makitang ganito, yung mga general term bitaw, okay? Both na talaga yan. Fluid volume deficit and fluid volume excess na talaga yan siya. Okay? Compartments affected, of course, fluid volume. Fluid overload can occur in either extracellular or intracellular compartment. Okay? Extracellular diyon sa ating intravascular. It could either be, kung extracellular, it could be in your intravascular. Saan pa? That's number 1. Number 2 natin sa ating interstitial. Remember that your intravascular, both your intravascular and interstitial, naana siya sa extracellular compartment na siya. And when we're talking about intracellular compartment, that means that, ano man to, ang imuhang cell jud mismo ang niborot. Okay, kuha natin. Let's say for example, sir, ano ba or what are the conditions or scenarios wherein muburot ng inyong cell dira? Okay? Pag naikuan, trauma or cellular injury, muburot man na siya, there's swelling. Okay? The tissues are swelling. Sir, tissues man to. Oy, your tissues, remember, your tissues are composed of your cells baya. Okay? So you will also have their cellular swelling. Or another example, pag maka-overdose ka og hypotonic solution. Okay, because if ever we're going to compare the solution inside the cell and of course the outside of the cell, tapos magbibigay ka ng hypotonic solution, mas concentrated ang mga solute dito, kaya it will now attract yung ating hypotonic solution na pumasok sa ating cell. That's why magkakaroon ng swelling. Okay, kuha natin. Ayan. So dito, For your extracellular, of course, that would lead to your congestion. Kung meron namang shifting from the intravascular going to your extravascular or to your interstitial, magkakaroon tayo ng edema. So congestion, and you also have there your edema. Okay, edema, dito yan sa interstitial. Congestion, dito yan sa intravascular natin. Okay, so you have there your occurs in either intravascular compartment. Yes, nasabi ko na to. Edema is the most common term. Diba sabi ko, pag edema doon sa interstitial. Hypervolemia doon sa ating blood vessel, nagkakaroon ng congestion. You also have there your isotonic fluid volume excess. That means that it is both your sodium and your water are being or nagkakaroon ng retention. Okay, and of course, anasarca, which is your generalized edema, or this is your severe edema already. Yan. So the causes, let's now talk about your etiology. For your extracellular fluid volume, extracellular. Dito, ito na mga how do you call this? Examples. These are all intravascular. And remember class, no, ang intravascular natin, part ba yan siya ng extracellular? Okay? So dito naman sa iba, you have there can be both your intravascular or your interstitial. Okay? So excessive sodium intake through diet, yes. Administration of hypertonic solutions, okay? Kasi remember your hypertonic solutions. Sorry, kung gani hypotonic, that is basically for your intracellular. We're talking about your extracellular, which is the intravascular space. Okay, di ba sabi ko sa inyo noon, your hypertonic is your volume expander. It expands the volume doon sa inyong blood vessel. Okay?
Isa mo ha? Alam mo ha, isa ha? Isa. Ulit na yun. Wala ka oras niya po. Ganyang tapon na alas 3.
Maminaw pa unta sa ilang mga chismis no kay. Ay na lang, masig natin ko. Okay. Asa na ba tayo? Oy, umuulan. Okay, blessing. This is a blessing, no? May pa ang yuta no kay kuan mabasa. Ang uban uga. Okay, going back. Hypertonic solution, this is one of the reasons bakit siya tinatawag na volume expander. So this is one of the cause for your extracellular fluid overload. Okay? Sana all mabasa, no? Sige. Di ba, remember yung sabi ko sa inyo, pag sinasabi natin hypertonic, these are your D5s. D5LR, D5NSS, pero hindi po yung, ano yung exception for your D5s? Ano yun na? Yes, exactly. D5 water. Okay, it is your D5 water. Okay, so ito yung sa ating mga hypertonic. Remember that your D5 water, ano ba ang classification ng D5 water natin? Hypotonic or isotonic?
Isotonic, sir.
Yes,
Iso,
very
sir.
good.
Isopos.
ISO. Pwede, pero depende. Okay, what do I mean by this one? Diba, sabi ko sa inyo, your D5 water, once hindi pa siya matransfuse, it is just isotonic. Pag once mag-infuse ka na and then it will go into your bloodstream or into your veins, magkakaroon ng metabolism dyan, it will now turn itself from isotonic, magiging na yan siyang hypotonic. Okay? Ayan. You also have your diabetes insipidus, okay, extracellular, congestive heart failure, na-discuss ko na, cirrhosis, na-discuss. Okay? That is why common dire, okay, ang I think this one, your congestive heart failure will present your pulmonary edema and as well as your peripheral edema. No, depending na lang kung ano yung side ng heart ang may problema. But all of these edema talaga yan sila. Okay? Magkakaroon ng edema. Manghupong jud na. Okay? Kasi this is extracellular. Okay? Ayan. That means that ito sila, interstitial. Ito sila. Okay? Interstitial compartment. Ito intravascular compartment. But both of them, the intravascular, interstitial, extracellular, it belongs to your extracellular compartment. Interstitial. So, interstitial. Pero nga nag-spelling ni mo, sir? Manifestations of your extracellular overload. You have there your pitting peripheral edema. Ito na yung ating mga manifestations. All of the edema, all of the swelling, ibutang na ninyo sa inyong utok, tanana, excess na siya. Okay? Excess yun na siya. You have there your periorbital edema. Asa man nadapit sa imong mata. Shortness of breath because of your pulmonary edema or pulmonary congestion. Okay? Shift of interstitial to plasma. O ano mayayari pag meron tayong shift to interstitial to plasma? Ano mayayari?
Congestion, sir.
Very good. It is your congestion. Okay? Nasa in number 15 nga question. Okay? Bounding pulse, jugular venous distension, nasabi ko na to, Anasar ka nasabi, rapid weight gain. Yes, pag dito meron tayong rapid weight gain, doon sa fluid volume deficit, what do you think will happen? Weight loss. Okay? Ba, madali lang? Okay? Gamay lang jud tong mga manifestation nga both pwede. Okay? So rapid weight gain, that is why it is very important for us to weigh the patient daily, every morning. Same time, same clothings. Okay? Ano na siya? Okay. Kasi it will also tell you kasi remember, di ba, 50 to 60% of fluid volume content is our weight, is the weight of the patient or is our weight. Okay? So dapat kung nag-respond tong treatment or if the body is responding from the treatment, dapat ang iyang pattern ana is mag-weight loss na siya. If na siya management, ha? If na management. Okay? If the fluid volume excess is worsening, what do you think will happen? Musaka. There is a pattern wherein musaka na ang imuhang weight gain ana or imuhang weight. Okay, moist crackles, again, this is pulmonary edema, tachycardia as well, and of course, hypertension. Dito, hypertension sa fluid volume deficit ninyo, hypotension. Okay? Ito. Sa intracellular naman, you have there your water intoxication. Ito yung sabi ko sa inyo, I've already discussed this one, hypotonic solution or hypotonic fluid na wrong or na mali og regulate, na mali og hatag, na sobraan. Okay? And cells run the risk of rupturing if they become too overloaded with your fluid. Kuha natin. Ayan. Kasi pag over-rehydrated tayo, class, of course, yung sa ating anong tawag ito? Yung sa ating plasma, mas concentrated kasi yung sabi ko sa inyo kanina that if you're going to, kung i-over dyan na ninyong pag-inom sa inyong tubig, of course, there will be a tilting of the homeostasis. Mas magiging concentrated na ngayon yung ating cells na inside our body. That's the reason why papasok doon, no, magkakaroon ng osmosis. Okay? Okay, wait lang. Sige. Umuulan na, so mahirap na yung ating connection. It's okay, it's okay, it's okay. Ayan. And the next causes of your intracellular overload, ito nga yung hypotonic natin. Okay. Ito yung, sabi ko, D5 water. Diba? Pag nasa labas pa, isotonic, and then pag nasa loob na, it will become hypotonic. Excessive nasogastric tube irrigation. Sir, bakit nagkakaroon ng intracellular fluid overload or fluid volume excess? Kasi class, when we're talking about irrigation, nagpa-flushing kanyan. Let's say, for example, may it be sa nasogastric mo or even sa bladder irrigation mo. Okay? You will be irrigating that one, or there will be continuous irrigation or continuous flow of your plain NSS solution. Okay? Doon sa inyong IV. Tapos, at the same time, you have to monitor the output. No? Kasi kung meron tayong orders na mga ganun, you really have to monitor the output because they are at risk of having fluid volume excess. Specifically, yung ating intracellular fluid volume overload. Okay? Kaya sige kag irrigate pero wala day mo gawas nga output sa iya sa pasyente, ginapaburot nimo ang pasyente ana. Okay? Excessive addition of free water, yes, due to your enteral feedings. That is why you have to check as well, no? Every after feeding or before you feed the patient, i-check nimo tong residual nimo nga gipakaon nimo sa iya nga OF. When we say OF, that is osteorized feeding. Unsa din ang osteorized, sir? Kana bitaw, that is another term for your blender ba? No, kanang gi-blender, no, osteorized, no, gi-blender nga feeding. Okay? So mao na siya. So you have to check if ever it is still on 40 or kung below 40 na siya or below 30, pwede mo na siya ipakain. Pero kung above 40 pa yan siya, wala pa rin na digest, pwede mo siya i-delay ang pagkain niya or pagbigay ng inyong enteral feeding. Okay? Okay. Syndrome of inappropriate, nasabi ko na to, this is your SIAD. Okay. Which will cause your hyponatremia. Okay, so wag kayo makuha na, that is what we call the dehydration of your sodium, class. Okay, dehydration of your sodium yun. Kasi there is hemodilution. So meron pa rin, ang SIAD natin is still fluid volume excess tayo. And you also have there your psychogenic polydipsia. Pag sinasabi natin polydipsia class, di ba sabi ko sa inyo, sa ating diabetes or DM, there are 3 P's, yung polydipsia, polyphagia, and polyuria. Pag sinasabi natin polydipsia, this is when we're talking in a cellular level, this is your excessive cellular thirst. Grabe pag inom. Okay? Usually, ato class sa DM. Mauna sa DM class natin, napod tayo fluid volume excess aside from your viscosity of the blood that will really increase the arterial blood pressure kasi viscous na eh. Kasi hindi na nagagamit yung glucose. So nagiging malapot yung blood natin. Aside from that one is because of this one as well. Excessive cellular thirst natin. Okay? Ayan, manifestations of your intracellular fluid overload. Neurological, you have your cerebral edema. Okay? Headache as well, irritability, confusion, anxiety. Yes, muscle weakness and twitching, meron pa rin. Okay, eto. Question ko sa inyo. Can you see muscle weakness then, or can the patient with fluid volume deficit experience muscle weakness? Yes or no?
Yes, sir.
Very good. So that is both. Both na siya. Sir, nga naman. Guys, remember, both your fluid volume deficit and fluid volume excess, no? Magkakaroon tayo ng problema natin dyan sa ating oxygen intake, oxygen distribution sa ating katawan or sa ating tissues. No, bakit nagkakaroon ng hypoxia sa ating fluid volume deficit? It's because baba ang ating water, so that means that dili kayo maka-facilitate ang movement of your water. Okay? Number 2, movement of your water, movement of your oxygen pala, movement of your oxygen. Now dito naman sa ating fluid volume excess, nagkakaroon tayo ng hypoxia din. So both your fluid volume excess and fluid volume deficit nagkakaroon ng hypoxia. Malalaman natin yan bakit nagkakaroon ng hypoxia mamaya, no, dito sa fluid volume excess. So that is why both of them nagkakaroon ng muscle weakness. Okay, respiratory natin, we have their dyspnea on exertion, and you also have their increased respirations as well. Okay, para kasi your lungs are trying to compensate, no, para mag-increase yung insensible water loss natin. Okay, tinutulungan. Gastrointestinal, you also have there your nausea and vomiting. Okay, so pwede ka ma-experience ng this one here is a compensatory mechanism. Okay, compensatory mechanism is dito. Doon naman sa ating fluid volume deficit, that is now the effect, or that is now the cause of your fluid volume deficit. Okay, increased thirst as well. You also have there your cardiac. Sir, increased thirst nga, kuan naman sir, there is fluid volume overload naman. This increased thirst, okay, this is now pathologic. Okay, kung meron tayong DM or diabetes mellitus, dili na ikaw mismo tong na-increased thirst, ha? It is your cells mismo. Pero again, it will still connect nga mo inom gyapon kag tubig ana, because of course signals are being sent to your brain, and then your brain will say, okay, giuhaw ako ang cells, so kailangan ko mag-drink. Okay, so you have there, it is referring to your pathologic process, and ito yung sinasabi natin na manifestation ng polydipsia o yung excessive thirst natin. Okay, sa cardiac naman, you have there your elevated blood pressure, yes of course, and of course you have there your decreased pulse natin. Okay, when we say decreased pulse, dili na tong kuan ha, decreased pulse rate, no, dili. This is upon palpation. Palpation mangyapon tong mag-check ang pulse rate, sir. Upon palpation, pero ito, ano yung difference dito? Upon palpation, pag palpate mo ana, maglisod kag pangita sa iyang pulso. Okay? Kay tambok na kaayo ang iyang anong tawag nito? Iyang blood vessel. Kuha natin, but there will be bounding pulsation pa rin. Okay? Diagnostic for FVE, same pa rin. Sir, let's say for example, question ko, diagnostic, serum electrolytes. Ito lang ilagay ko, serum electrolytes. What are you going to write? Fluid volume deficit, excess, or both?
Both, sir.
Both siya. Because we're not talking about the results. Both of them uses serum electrolyte as a diagnosis. I'm sorry, laboratory diagnostic examination. Both of them uses serum osmolality. Okay. Now the question is, it will now, anong tawag dito? It will now differ sa ilang result. Okay. Kung sa ato ang fluid volume deficit, what do you think? FVD tayo. What do you think will be the result for your serum osmolality?
Increased, sir.
Increase, sir.
Okay, exactly. Increase yan siya. Fluid volume deficit increase. But that depends, ha? That depends still, di ba, remember you have your hypernatremia, hyponatremia, and isonatremic dehydration. Magdedepende pa rin yan siya. Mataas ang ating serum osmolality pag meron tayong natremic dehydration. Meaning, mas taas ang ato ang water loss. Kuha na to. That makes it high concentration. Okay? Pag sa fluid volume excess, okay, don't worry, katong sa uban nga nagaputol-putol daw ako ang tingog, this is recorded so I can still give this one to you, no? After ma-upload ko ito. Okay? For fluid volume excess, baba talaga yung serum osmolality mo. Kuha natin. Ayan. Serum hematocrit natin dyan and hemoglobin. Let's focus on your hematocrit levels. Okay? Pag, for your hematocrit levels, what do you think will happen? Both of them are using both of them are using this diagnostic examination for your fluid volume deficit and fluid volume excess. Pero for your hematocrit, pag mataas ang hematocrit natin, what do you think? FVD, FVE? This is still related to your concentration class. Pero it talks about the concentration of the blood doon sa ating RBC or in relation to your RBC and to your blood, the whole blood mismo. Unsa man. Pag increase atong hematocrit, it means increase ang concentration. Unsa man na siya? FV. Unsa to? Deficit? Yes, exactly. It is your fluid volume deficit. Okay? Sir, saan kung magbaba yan siya? Of course, pag mababa ang ating hematocrit, FVE yan siya, or you have there your anemia. Okay? Same with your hemoglobin. Okay? Often are decreased due to due to plasma dilution nga. Okay? Same with your, kung ito hematocrit, you also have there your hemoglobin, mababa siya dito. Okay, kuha natin. Ayan. You also have there your renal and liver function. Pag sinasabi natin renal class, renal, ano yung mga renal function test natin? Kidney function test. Urinalysis.
Creatinine, sir.
Pag function, renal function, pag kidney function, this is when we're talking about renal function or kidney function, that is your BUN
FR,
and
sir.
CREA. Okay? Pag liver function naman, this is your ALT, AST, yung mga aspartate natin. ALT, AST. Okay? Sa una, SGPT pa na siya sa una, SGPT or SGOT. No, pero the term that they are using right now is your SGPT and your SGOT. Okay? ABG natin, okay, fluid in the alveoli impairs gas exchange. That means that nagkakaroon ng hypoxia. That means pag may hypoxia, okay, of course, naka-oxygenation na kayo, di ba? One of the factors or yung tinitingnan natin sa ABG for us to read is yung bicarb, pH, bicarb, and carbon dioxide. But, sir, nakalagay uban na ay partial oxygen or PaO2, partial pressure of oxygen or your partial or your O2 saturation. If you're going to include that one in your ABG reading, it will help you identify kung na ay hypoxia. Okay? Here, ito na yung reason kung bakit nagkakaroon ng hypoxia. Because if there will be fluids in the alveoli, it will now impair the gas exchange. Okay? Kuha natin. So this is now the reason kung bakit nagkakaroon ng hypoxia. Okay, sa ating fluid volume excess. So evidence niyan, baba yung ating partial pressure of oxygen natin or your O2 saturation, mababa din yan siya. Okay? Medical management, of course, ano dapat yung medical management natin? Okay. Prevention in patient at risk, of course, first is prevention, and then you're going to treat its manifestation and correcting the underlying cause. You're going to check now, or of course, the physician will check na kung ano yung cause ng inyong fluid volume excess. And then from there, pag malaman na nila, kung ma-diagnose nilang tarong ang pasyente, kung bakit nagkakaroon siya ng fluid volume excess, ayan na. Doon na yung ibigay yung mga specific medication sa kanya. But if we're talking about yung medical management, what do you think is yung common na binibigay sa ating fluid volume excess?
Diuretic, sir.
Very good. That is basically your diuretics. Okay? Now remember that your diuretics, di ba sabi ko sa inyo noon, you only have 2 types of your diuretics. Though there are a lot of classes, or I think 4 classes of your diuretics. Ang isipin nyo na lang talaga is you have there your potassium wasting, and you also have there your potassium sparing. Sparing means ginasave niya ang imong potassium. It is a diuretic, but you will not be losing that much of potassium. Okay? So ito, you have there your loop diuretics. Of course, your diuretics will work on your renal tubules. Okay? So for your loop diuretics, ito yung ating mga common loop diuretics kani. Common yun siya, furosemide. You also have there your, kaning uban, wala na ako kabaluan niya eh. Dili ko, or I haven't seen, or I haven't administer that one. No? Common yun yung furosemide. Okay? For your loop diuretics. Sir, tanong, loop diuretics, potassium wasting or potassium sparing? Wasting. Ito, thiazide, wasting gyapon na siya. Okay? So here, para hindi kayo mawala, you have their thiazide, 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 thiazide. Okay? Mga thiazide, these are your thiazides. Diuretics pa rin, but it is still potassium wasting. Sir, ito, potassium sparing na talaga yan. Pag makakita ka ng nolactone or spironolactone, or I think this is the brand name, aldactone. Mauna sila ang common, no? For your potassium sparing. Okay? Pag sinasabi natin diuretic, sir, how does it help fluid volume excess? By excretion sa ating urinary or sa ating urinary tract. Okay? Pampaihi yung ating diuretics. Okay? Kuha natin. Ayan, fluid management, fluid intake may be restricted, no? Ito, that's the reason why kailangan din natin i-monitor INO pa rin. When we're talking about INO, is INO also applicable for your fluid volume deficit? Ano man ang INO? Intake and output monitoring ba? INO monitoring? Oo naman. Okay. INO monitoring for your both yan siya, for your fluid excess and for your fluid volume deficit. Kuha natin, both na siya. Okay. VS, both gihapon. Okay. So restriction sa fluid, and then the amount of fluid allowed per day is prescribed by the primary care provider, and then all fluid intake must be calculated, including meals and yung mga medications natin that is being administered orally or IV, yung mga liquids natin. Okay? So for your dietary management, low sodium tayo. Okay? Because sodium retention is primary cause, of course, low sodium tayo. Low sodium or sodium restricted diet is often, restriction na gani ito. Okay, restriction na ni sa klasa. Sorry, mali ito akong pagkaingon nga low sodium. It is sodium restriction na ito. The primary dietary sources of sodium are, ito na yun siya. Yung mga processed foods natin, di ba sabi ko sa inyo, yung mga processed foods natin, the reason why, bakit mataas yung kanilang sodium chloride doon or your sodium content doon, it's because itong sodium, it helps na dugay kaayo mabulok ang inyuhang mga processed food or processed meat, like yung mga delata ninyo. Kana. Okay, taas na silang mga sodium content, kana mga junk foods na to, dugay man na sila mabulok. Tanawar ko na yung bulad, perting parata, di ba? Usay gani wala na nagilaluto, diretso na siya kaon. Pero lahi magpud ko ng lutuon siya kay baho pud kaayo kung ano, diretso kaon. Okay, nursing management. Ito. So it focuses on preventing fluid volume excess in patients at risk on managing problems resulting from its effects. So again, assess vital signs pa rin natin tayo dito, heart sounds. Pag meron kasi tayong congestive heart failure already, that is basically fluid volume excess na yan siya. Magkakaroon tayo ng additional heart sounds. What are your normal heart sounds ba? Ano ba yun? Yes, your lub-dub. Okay? To be more scientific, it is your S1, S2. Okay? Yung ating kuan, yung ating murmurs, you have there your S3. Yung galloping natin, you have there your S4. Okay? Now, there are times wherein pag bata ka pa masyado, meron ka marinig na S3. And that's normal. That's the physiology of your newborn. Pag matanda ka naman masyado, you can hear S4. That is also normal. That is physiology of aging. Okay? Pero kung naa ka sa adult, no, sakto-sakto pa ang imong edad, and then you will be heard or you will be hearing S3 and S4, then that means that meron tayong problema. No, nagkakaroon tayo ng congestion, no, sa ating heart and volume peripheral arteries. Yes, okay, CVP monitoring, no? Auscultate lungs for presence, auscultation of the lungs for your crackles, wheezes. This is basically your, anong tawag dito? Adventitious breath sounds. Okay? Pag sinasabi natin adventitious, this is a general term, no, that is talking about the abnormal breath sounds natin. You have there your wheezes, your crackles, your stridor, okay, your rails or yung rals natin. Okay, your crackles and rals, they are synonymous naman din eh. So, eto na lang, wheezes natin, when can you usually hear that one? Expiration or inspiration, or I'm sorry, exhalation or inhalation?
Inhalation, sir.
Inhalation, wheezes.
Exhalation, sir.
Yes,
Exhale.
exhalation. Remember nyo lang ito ha, i-remember nyo ito. Pag wheezes gani class, ito, wheezes. Wee! May siya, may E. Kasi ito talaga usually yung gina-compare eh. You have there your wheezes, and you have there your stridor. Okay? E, I. Stridor, inspiration or inhalation. And you have there E for wheezes, expiration. Sir, naririnig ba ating wheezes during inhalation? Yes, pwede pa rin. Pero, most of the time talaga, exhalation yan siya. And if ever you are, eto, tinuro to no, sa oxygenation ninyo, kung ang inyong patient na-admit sa ER, okay, tapos na ay wheezes, tapos taod-taod nawala, pero makita ang gyapon nimo siya nga naga-blue. Okay, what do you think? Is that a bad sign or a good sign? Kana nawala ang wheezes. Gi-admit siya na ay wheezing. Taod-taod nawala ang wheezes. Is that a good or bad sign?
Bad sign, sir.
Bad, sir.
Bad. Nga naman.
Nagaginhawa, sir.
Wala na naginhawa. That means that there is already a total closure of your airway. Mao na dapat kung nai-admit sa inyo nga sa ER department unya naga-wheezes pa, that's good, no? That's a good sign. Pero pag difficulty of breathing na pud siya, di na pud siya kaginhawa unya nagatanaw nimo, wala naman siya wheezes, pero ang iyang now naga-blue na. Okay, cyanotic na. That is basically kuan na, naga-constrict na jud maayo ang inyuhang airway, and that is what we call a severe form of your asthma. That is what we call your status asthmaticus. Ang binibigay natin sa kanila is your epinephrine. Dili na sila matablan og bronchodilators nato. Kuha na to. Dara. And of course, monitor O2 saturation, because remember, fluid volume excess, aside from the O2 saturation sa ating pulse oximeter, check for the ABG, kasi nga your fluid volume excess can lead to hypoxia. Does your fluid volume deficit lead to hypoxia as well? Yes or no? Yes. Natubag na ninyo ganiha, class. Wala, eh. Si tawag ana eh. Assess the presence or extent of edema. Yes, yung nga sabi ko, start from the lower part of the lower extremities paakyat, work your way up to check for the extent of your edema. And then in the lower extremities and the back, back natin yung sa ating, because of, bakit sir, back, buffalo hump, na dire. Okay, kanang sa likod ninyo, sacral and periorbital areas. Okay, because the reason why nga nung dito nga nagapanghupong sa face, sa ato extremities is because of gravity, and at the same time, it has, I think, no, a weaker capillary. Mas weak ang mga capillaries dito. Okay? That is why dali lang kayo mag-leak, no? Nagkakaroon ng leaky capillaries. So daily weights din tayo dyan. Same time, same days. Nasabi ko na yan dyan sa inyo. Same time, same... Same time, same day, sir. Same time sa adlaw, no? Every day. Same time, every day. ka ra ka, sir. Same time every day and the same time change or same clothing. Okay. Nursing management, yes, administer oral fluids cautiously, no? Adhering to prescribed fluid restriction kung unsa lang tong gi pa regulate sa mga rate mo ra pud to, no? Ayaw ninyo ni buhati class, okay? Tama ko times, 'di ba, one of the factors that would influence the rate of your of the drop rate ninyo sa inyong drip chamber kay kanang sig change of position kanang bitaw mga labad pud kayo ng mga pasyente kang lihukan samok kayo na sila, no? It's either ma-underdose ka or ma-overdose magud ka or malapas ka gamay ba, okay? Na magoy uban man good, no? Ako wala jud ko ani ha, sa tinuod lang wala jud ko ani tuo mo class, no? Naka-overdose ko sa mannitol na to, wala ko ani, even if ma-underdose ko wala na ako na ginapaspasan, okay? Kay kuan man na it would also affect manggod the fluid intake of the patient intravascularly, okay? So kung kamo sa tanaw nimo, hala, dapat ang level sa akong IV is dapat na sa below 500 ngano na pa man sa 700, so makasab-an ka. Usually ang ginaingon sa mga CI, unsa man nato ng sobra painom nato sa pasyente, ngayon ana pa jud ng mga batasan, ay bot na lang. Sige, so you have to be cautious on regulating, okay? Of course, discuss the restriction as well, kung nganong inani ang allowed lang, provide oral hygiene as well. Kay oral hygiene contributes to patient comfort, mucous membranes intact because anong tawag ito, pag fluid volume excess, then there's a possibility na magkakaroon ng mga kuan tayo dyan. Mga, I'm sorry, nakalimut ko class. Okay, nakalimut ko. Sorry. Provide oral hygiene at least every 2 hours. Oral hygiene contributes to patient comfort and keeps mucous membranes intact. Kasi it will contribute to your, pag sinasabi natin fluid volume excess, okay, decrease, no? Meron tayong hypoxia. That means that the diffusion of your oxygen is also low. No? Hindi masyado maka-reach yung mga oxygen levels natin. Thus, it will now increase the chances of the patient to develop yung mga ulcers natin. Okay? So magkakaroon tayo ng impaired skin integrity din. Okay? Ayan. Teach patient. Ito din class, baka hindi kayo familiar, no? Na yung mga patient wherein NPO sila. NPO sila because maybe nasa surgery or they will be undergoing diagnostic examinations. What they do, no, pwede na pahidan o kuan o cotton tapos ang ginabuhat namo sa una, no, kanang cotton, and then ginabasa namo ang cotton, may it be with kanang mga soft drinks, no, kato sa pedya ba, mga soft drinks nila tapos ipahid lang na dira. Okay, kay mag-complain man jud ang bata ana, pa uhaw ko ana. Teach patients significant others about sodium restricted diet. Yes. Administer prescribed diuretics as ordered. Yes. From report significant changes in serum electrolytes. Yun nga, osmolality. Serum electrolytes pag FBE, what do you think will happen to your sodium level pag FBE? Taas, baba?
Baba, sir.
Yes, very good. Baba. Okay. Osmolality natin, bababa rin yan siya. Pag we're talking about sodium, sodium to na kuan electrolyte na serum. Ayan. Para ma-report mo yung unnecessary. Nursing diagnosis, you have their fluid volume excess. You also have their risk for impaired skin integrity because of yung sabi nga, tissue edema decreases oxygen, hypoxia pa rin. And impaired gas exchange because of hypoxia pa rin. Fluid volume excess, ayan, includes collaborative interventions such as administering diuretics and maintaining a fluid restriction, as well as monitoring the status and effects of the excess fluid volume. So you have their fluid volume excess, risk for impaired integrity, and impaired gas exchange. Oh, di ba? Tapos na. Okay. Ay, Diyos ko, Lord. Ayan. Tapos na, di ba? Maganda talaga makakita ng maitim. No? Kumpiyansa ka ng mga itom, no? Sila yung nagbibigay kulay sa mundo. Charot. Mga adobo. Adobo Republic. Woot, woot. Mga Adobo Republic. Okay, so are there any questions? Wala. So katong mga itom dira, no? Itaas natin mga bandera ng mga Adobo Republic. That means that itom ka tungod you are hot. Sa sobraan kahat nimo nasunog imong panit. Okay? Ana na siya. Build confidence within yourself. Masing ikaw lang ang nagabilib sa imong self. That's okay. No? Ano lang, tiwala lang sa sarili. Okay. Ayan. So before we go, sabay-sabay tayong kantahin. Kantay. Lata, sabay-sabay tayo ha. Yung kinanta ko kanina. Okay, repeat after me. Kuha na. Unmute na lahat. Unmute para ready na. Ready na. Unmute na. Unmute. Gaya. Uy.
Lugi ta kay Rachel, ano?
Unmute. Okay, 1, 2.
Gusto nilete.
Okay. Tell me. Kayo na class.
Tell me.
Ay, mali ang instruction ko. Pag sabi ko tell me, sabihin nyo, where did I go wrong na kanta? Yun na. Sige na lang, good.
Sir, sumpay-sumpay din eh, sir.
Sumpay. Isa pa. Okay. Tell me.
Where did I go wrong?
Alang aso nag-awa. Okay. Ayan, thank you very much class for giving patience to me. And tomorrow isang bundakan sa ato ang sa tawag ana basta ang ugma the Pambawi quiz 10 items pa rin. It will be available 4 p.m. down 11:59 p.m. no, so 30 minutes na siya, so use whatever resources you need, no, kung mag-google mo, sige google mo. Wala siya. But for the other quiz which is your fluid volume excess and fluid volume deficit, di ba sabi ko tatlo yung pagpipilian ninyo, fluid volume excess, fluid volume deficit, or both. Okay, so mao lang jud to. 25 items to siya. Okay, for 25 minutes. So mao to siya. Okay, and it is only available for 15 minutes, 4 p.m. down to 4:15. Kasi that is my way of checking your attendance as well. Okay, kung namoy problema ana before 4 p.m. tapos dili mo makatake, ayaw ninyo i-take kung hinay kanyong internet, I will give you a special quiz. Walang problema doon. Okay? Ayan, sige. If there are no questions, no violent reactions, let us pray. Let us pray. Miss Montiel?
Ay, sir, naka-question. Mag-klase pa ba tayo mo, sir?
Friday pa man ugma.
Ganit.
Kani si Miss Untuwa ba kay advance jud.
Disoriented, sir. Sorry, sir.
Grabe jud. Mura nakaingon sa ganahan makipagkita sa imo.
Ay, nag-altered mental status na si Miss Unpo.
Nag-alter mental.
Subahan nag-IV, sir.
Grabe na sa may gipang inom dira Miss
Isat
Untuwa.
niya ang plain NSS.
Uy, bitaw no kana inyong activity bitaw ba? Murag feel jud nako na jud nagtilaw no, nagtry og tilaw sa mga IV solutions. Feel jud nako no. Feel jud nako naa jud na. Ngano bitaw curious kayo unsa may kuan ani gipatulo ninyo, tilawan ninyo. Okay lang na sa class, wala siya problema. Gamay ra man to, di ba? Basta gamayng tilaw-tilaw, okay ra na. Diba? Gamayng igat-igat, okay na.
Correct.
Pag dinagko na, dira na, no? You will be having kuan, mura na kag nagkuha og bato nga ipangpukpok nimo sa imong ulo. O sige. So yun lang class. Let us pray. Miss Kuan Montiel, can you lead the prayer?
Yes, sir. I invite all the Catholics to make the sign of the cross there. Thank you, Lord, for everything that we have learned today. Thank you for everything that Sir Aldrin has taught us, and may we retain all the information that we have learned today. Amen.
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 Okay, goodbye, good night. God bless and happy dinner class. Bye-bye.
Thank you, sir.
Thank you.
Yes, sir.